Hi, this is Anil Dhall reporting from the hot summer of Delhi, where it can get to be a blistering 45 degrees, and yet there is so much beauty all around and so many good things to look forward to. Ordinarily, cardiologists talk about winter threats. Let's discuss what the Delhi summer brings to us. Well, while we can picture the golden shower of the amartas, the scarlet, orange, or the deep yellow blooms of the gulmohar lining the trees of our streets, or the shades of purple pink of the pride of India, or kachnar, pilkhan, and the cool shades of the neem, while the bougainvilleas, the hibiscus, and the marigold blooms, we also think of the various avatars of mangoes. We all know what starts first, what comes next, what is to be looked for, and everybody has their personal favorites. And it's not just mangoes, it's mango ice cream, mango shake, aam panna, watermelon, melon, lychee, all pulpy fruit. We also have coolers like lime water, nimbu pani, which traditionally most Indians wanted sweet and salt, with aam panna, lassi, and buttermilk thrown in. The vegetables change the landscape from the green leafy vegetables of the winters, which contain a lot of vitamin K and other things. It changes now to the more dull and drab vegetables. Maybe ladyfinger or okra or bindi is an exception, but we have the loki, tori, and tinda, which as a child we used to generally pass. Well, there are also flies and a lot of other infections which come in. So this is the background. How does it affect the heart? The heart, we have patients who've got heart failure, high blood pressure, diabetes, obesity. Some people have post-stent. They're on medication. Some of their medicines, like diuretics, within this intense heat can cause them dehydration. But should you skip diuretics? No. Please speak to your doctor once. But diuretics may be very, very essential part of your armamentarium to treat you, especially in patients with heart failure or even blood pressure. But how much fluid should you take? Well, you could keep your urine light or pale yellow, not deep yellow, not dark yellow, and not absolutely clear, to know that you're hydrating reasonably. What about the other hydration hacks? Should we go for the sugarcane juice, which is like a sugar bomb, or some of the proprietary cold drinks, which have possibly zero benefit? Or should we think of the light lemon water? Maybe if you're hypertensive, go slow on the salt. If you're diabetic, go slow on the sugar. And also maybe buttermilk, which could be a smart choice. Not the sweet lassi, but really the light charge would be beneficial. Again, keeping salt in mind. We know that if people who are on blood thinners, if their vitamin K antagonists were regulated during winters to an amount of vitamin K which is coming through green leafy vegetables, then the vegetables actually change in summers. So we have to keep the greens consistent with no summer salad binges, truly. And we should be able to adjust this to having a good therapeutic INR. Well, what about exercise? Most gyms today are air conditioned, so it should be okay. But if you decide to exercise excessively in the extreme heat, it could be dangerous. It could lead to dehydration. And preferably, if you're going for a morning walk, take it only either late at night or early morning. Stop if dizzy, breathless, or chest is tight. So Delhi summer has heat stress, but we can stay smart to stay safe